Good afternoon, student. My name is Miss Manisha Borkar, Department of Fishery Science, NES Science College, Nanded. Now, today's we will going to start the semester third, theory paper sixth. The name of paper is Fish Disease Management. Okay, theory paper sixth. The name of paper is Fish Disease Management. Now today's we will going to start the unit number 4th. The topic is mineral deficiency, okay, which is related to the nutritional deficiency diseases. Okay, in that mineral deficiency we will see that the various mineral deficiencies which will be occur due to the minerals in the fishes. Okay, firstly we will see here the introduction about the mineral deficiency. Okay, nutritional diseases, Sinesco 1972, the deficiency, excess or improper balance of the components present in a fish diet. Okay, the in nutritional diseases, the Sinesco, they will be in the year 1972 they will occurring or the deficiency of the nutritional diseases, in that the various excess or the improper balance of these components which will be present in the fish diet. One of such a disease is the mineral deficiency or a toxicity. Okay, in that nutritional diseases we will see here the mineral deficiency as well as the toxicity. Okay, in that mineral deficiency they will be occur due to the minerals deficiency. Toxicity means that there is the presence of that the high dosage of that the minerals in the fish diets, they are occurring the toxicity in the fishes. All forms of aquatic animals, they require inorganic elements or minerals for normal life processes. Okay, as we know that the aquatic animals, they require the inorganic elements, they will be formed in the natural resources as well as in the artificial resources. Okay, fish have the availability to absorb some inorganic elements not only from their diets but also from external environment. Okay, these fish, they will be observe the elements from in the form of that the inorganic elements, then the in the form of that the external environment. Now seen here, what is the minerals or the what is mean by the minerals. Okay, all the living organisms, they contain most of the naturally occurring inorganic elements from the periodic table. Okay, we will knows that the periodic tables we will seen the various elements, they will be present in the periodic tables. Okay, these are minerals, they will be present in the form of naturally. Okay, these will be the occurring in the natural forms. Out of about 90 elements, 22 elements are known to be essential for the living beings. Okay, in that all over the these elements, the 22 elements, we will know that the essential for the living beings. Okay, firstly we will see the structural elements. Okay, in that structural elements we will that how means what is mean by the structural elements. Okay, these are structural elements, they are be used for the structural analysis, and they will be split a complex structure into a simple elements. Okay, these will split the complex structure into simple elements. Okay, in that structural elements, the carbon is also present, hydrogen, oxygen, then the phosphorus, nitrogen, and the selenium. Okay, these are the structural elements. In a macro elements, as we know that the macro elements, they get the more amount of presence of that, the more amount of that the minerals, that is the calcium, then the magnesium, potassium, sodium, and the chlorine. Okay, then the micro elements we are called as the trace element. They means that they will be present in a trace form or in a less amount, that is chromium, cobalt, copper, fluorine, iodine, iron, manganese, molybdenum, selenium, zinc, nickel, vanadium, silicon, then arsenic. Okay, these are the structural macro and the micro elements. Now, essential elements. An element is considered essential when a deficient intake produces an impairment of function, when a restoration of the physiological levels of the element that prevents or relieves the deficiency. Okay, these essential elements, they will be prevent the physiological activities of the fishes. Main functions of essential elements in the body. Okay, they how the functioning of that the essential elements in the fish body: formation of skeletal structure, that is that is the calcium and the phosphorus; maintenance of a colloidal colloidal system, they form that the sodium, then the potassium, then the chlorine; regulation of acid base equilibrium, they will be phosphate, carbonates, then the bicarbonates; important components of hormone enzyme and activator system, they will be carried out by the calcium, then the manganese, then the magnesium. Okay, seen here the chart flow. Trace minerals important for a fish, that is cobalt, arsenic, we will see in a previous slide. There will be the minerals and the requirements of the minerals in mg mineral per kg dry diet. Okay, in the fishes, iron will be 30 to 170, copper 1 to 5, manganese 2 to 20, zinc 15 to 40, cobalt is 0.05 to 1, selenium is 0.15 to 0.5, then iodine is 1 to 4. Then the bioavailability of the minerals. Okay, factors influencing bioavailability of the minerals include the intake level of the nutrient, its a chemical form, the digestibility of the diet, then particle size, interactions with other nutrients. Okay, then the inhabitants, physiological and pathological changes of the animals, then the water chemistry, type of feed processing, etc. Okay, these are the bioavailability of the minerals. Seen one by one how the deficiency occurred due to these mineral elements. First is iodine. Fish meals contain iodine, so modern diet do not exhibit iodine deficiency. Deficiency causes goiter, that is thyroid hyperplasia, as originally described as adenocarcinomata. Okay, the trend towards replacement of a fish meal with a plant protein sources may bring goiter back into picture. Iodine supplementation at 4.5 mg per kg was beneficial to Atlantic salmon exposed to the BKD. Law 2020. Okay, according to this scientist, the 4.5 mg per kg body weight, they will be iodine supplementation will be important for the fish. Salmonellitis, which cause the thyroid hyperplasia, goiter. We will see in this picture, there will be the fish occurring, that is the disease that is called as a goiter due to the deficiency of the iodine. Senior iron deficiency, hypochromic normocytic anemia demonstrated in iron deficient brook trout, yellowtail, red sea bream, carps, eel and catfish. Okay, they will be occur this disease due to the deficiency of iron in eel fish, then the catfish, then the various carps. Okay, hypochromic microcytic anemia in the Cyprinus carpio. There will be the stages of the microcytic hypochromic anemia. Okay, in that disease, in that hypochromic disease, they will, in that the patient with the hypoanemia, they have a very distinct green skin teenage. Okay, there will be the various problems will be created to the fish. There is a shortness in their breathing, then the headaches will be occur, diarrhea will be occurred in the fishes. Okay, in that stages, there will be the first is a normal stage, then the microcystic means there is a very small structures will be small red blood cells will be present here. In a macrocystic, there the size will be the large. Okay, then the hypochromic, then the disease will be occur microcytic hyperchronic anemia. There will be the all green the blood cells, or they will occurring the green skin teenage. Okay, here's the iron excess. Okay, in excess or the high dosage of that the iron, they will be occur toxicity at a high level is a major problem than the deficiency. Melanomacrophage system of the hematopoietic tissues plays an wide role in a retention of iron in a body following hemorrhage or the infection. Toxicity of ferric ions in a contaminated waters is the most observed effect on the iron. Causes pathological changes in a rainbow throat liver, specifically vacuolated hepatocytes appearing to contain a large amount of fat and reduced levels of glycogen. Hepatocytes exhibits pleromorphic nuclei with large intranuclear inclusions and the peripheral clumping of the chromatin. Next is a copper deficiency. Okay, due to the the deficiency of that the copper deficiency is the most unluckily because of this because of its ubiquity in water. Shrimps unable to meet dietary requirement for a seawater deficiency signs in a shrimp, they will reduce the weight gain, feed efficiency and the proper level body requirement high, because in invertebrates copper is a constituent of oxygen carrying pigments in a blood cells. Okay, in that there will be the without copper supplementation develop there the characters. So Cyprinus carpio reduce growth and the cataracts. Here the toxicity of the copper in a fish body. Okay, in a toxicity will be occur due to the high or the excess dosage of the copper in a fish diet. High copper exposure diet of water, they will growth reduction, increase in intestinal cell proliferation and the apoptosis, reduced growth, dietary level above 15 mg per kg. Here is the diagram shows the way disease will be occur due to the copper toxicity. The gill epithelium is inflamed, thickened and degenerated. Excessive mucus is secreted. Gill function and resistance against the parasite and bacteria establishment are compromised, and the liver and spleen appear pale and the degenerate. Here seen the liver they will be occurring in a pale and the degenerated. Potassium deficiency, general deficiency signs, they reduce the growth and feed efficiency, anorexia, convulsions, tetany. Then the death will be occur due to the potassium deficiency. Then the manganese. Okay, manganese deficiency reported in a fish feed on a diets with a high calcium or a ash content. Deficiency, they will occur the poor growth and feed efficiency, then the nutritional contractors, then the skeletal abnormalities noted for the rainbow trout, carp and tilapia. Roberts in a year 2012, they will forms the how the skeletal abnormalities will be occur due to the deficiency of that the manganese. Egg hatchability in a rainbow trout is reduced when a brood stock fed without manganese supplementation. Okay, this will be the in a Cyprinus carpio, they will be reduced their growth, short body, dwarfism, then the contractors. In in that the Pusipelus mosambacus, they will be reduce the growth and the appetite, loss of equilibrium, then the mortality or the death will be occurred due to this manganese deficiency. Okay, this will be the picture of that the deficiency of the manganese in the fish. Okay, phosphorus, fish can obtain from rearing water, but water levels are too low to supply the needs of fish. Phosphorus deficiency not seen when a fishes feed with the fish meal. Okay, this fish rearing water, they will occurring the low supply of needs to the fish to the phosphorus deficiency not seen when fishes feed with the fish meal. Deficiency signs anorexia and dark coloration. Specific signs deformities of a head, ribs and vertebrae. Primary role in a bone mineralization. Combined deficiency of phosphorus and the combined deficiency will be occur in the phosphorus and the carbon, causes failure of ossification and bones become rubby. Deformity of a trestix, articulation of the jaw may lock open to produce deformed fish called screamers, depending the scream that Edward much. Okay, other signs will be seen in the phosphorus deficiency. They reduce growth, poor feed efficiency, then the bone demineralization, then the skeletal deformity, abnormal calification of the ribs and the soft rays of the pectoral fin, then the cranial deformity, increase visceral fat. Okay, this will be the picture. We will see in that there is a spinal vertebrae of salamanids on the due to the deficiency of the phosphorus in the fish diet. They occur the in that A, B, C. There will be the A means that the normal rainbow thought, then the B is the experimental deficiency in a rainbow thought, then the C means that the deficiency in the form of Atlantic salmon. Okay, in that picture there will be the spinal vertebrae of the salmon fish. Okay, this picture of salamonid fish. Okay, this will be the occurring in that the fishes in the Cyprinus carpio, then the punctanus, then the way these are the fishes they are occurring, or the some are the symptoms will be same in all fishes in all fishes organism, then some having a different symptoms. Okay, this also the diagram of that the due to the deficiency of that the phosphorus in the fish. Selenium. Okay, this diagram showing the deficiency of the selenium deficiency. They depresses the growth in the rainbow throat and Chanial catfish, but does not induce pathological changes unless vitamin E is deficient. That Roberts they conclude or discover the in 2012. Okay, selenium and the vitamin E supplementation prevents bland muscular dystrophy. Okay, in a salar increase mortality, muscular dystrophy, depressed glutathione peroxidase enzyme activity reduce their growth. In Cyprinus carpio they reduce growth. Anemia, then in punctanus they reduce the growth. Zinc deficiency, they will be occur bilateral central or the sublenticular contractor development in a young salamanids. They poor the growth and darkening to the color. High level of ash, calcium or the palanate in the diet, they inhabits the zinc absorptions. Okay, in that other signs, erosion of fins and the skin, short body, dwarfism and the poor eggs hatch availability. There will be the particular functions, they will be occur in the Cyprinus carpio, then the punctanus. The calcium, the high requirement for elaboration of calcified tissues such as bones and scales and the maintenance of electrolyte levels. Deficiency, unluckily calcium can be readily absorbed branchily. Imbalances with other dietary components leads to metastatic classification and the impaired absorption of the iron, copper and the zinc. Anorexia, poor growth and the poor feed efficiency are the general deficiency signs in most of the fishes. Okay, these will be the particularly this disease, they having the signs of that the fish in punctanus, then the major various major fishes, then the mycis. Now seen here the calcium toxicity. Okay, due to the high dosage of that the calcium toxicity, they will occur the renal calcification in the rear part of the kidney. Okay, this first diagram is the kidney part, kidney in a rainbow thought, and obstruction of the uterus with the classiform. There will be the diagram of that. The second diagram which is related to the ureters, they deposit in the nephrocalcinosis syndrome. Okay, this will be the syndromes will be occurred due to the excess dietary calcium may be associated with the nephrocalcinosis and the erythesis due to the and they will be occur then the granulomate throughout the body and even in the eye and also brain. Okay, then this is a picture which is related to that the calcium deficiency. In that some other toxicity signs. Okay, how the toxicity of the they will be occur, lead the blackening of the caudal area, black tail and scoliosis, lordosis, anemia, degeneration of a caudal fin. Okay, this will lead to the or they will this disease will be occurred in the caudal fin due to the deficiency or toxicity of the lead. Then candemium, a very specific syndrome of hypocalcemia. Then the hyperexcitability and the osteoporosis. Other includes scoliosis, then decrease bone calcium content, etc. In chromium, they reduce the growth and feed efficiency. Okay, thank you. These are the mineral deficiency diseases. They will be occur due to the various structural elements, then the various macro and the micro elements we will seen in the nutritional diseases.